Welcome to another edition of Politics and Right. I'm Egberto, Willies, your host today. I'm honored to have Dr. Wilcox. Dr. Wilcox is a doctorate prepared nurse who also holds a master's in health administration and is board certified in nursing informatics. Dr. Wilcox has 28 years of healthcare experience in which he worked as a bedside nurse, hospital administrator, and in healthcare information technology, which has helped him to develop his unique perspective on the American healthcare system. Dr. Wilcox is the author of the book, How to Avoid Being a Victim of the American Healthcare System. This is the second time we're talking, and one of the reasons I wanted to have Dr. Wilcox on is we know the issues that are governing us right now, and we understand with the killing of Mark Thompson of UnitedHealthcare by Mr. Mangione. It's a big topic of discussion. Dr. Wilcox, welcome to Politics and Right. Thank you so kindly for being here.
Thank you, Egberto. It's always good to see your smiling face and to educate the American public on what's really going on in healthcare, especially in a situation where the CEO of UnitedHealthcare, Brian Thompson, was murdered in the streets. So we're going to have a robust discussion today for sure.
Yeah, well, let me ask you this. Without my interference or whatever, what are your thoughts about that incident, specifically that incident and the rationale that Mr. Mangione is using? I don't know if he's in his right mind or what, but the rationale that he's using. What were your initial thoughts?
Well, it's interesting because a lot of Americans have been hurt by the insurance companies denying their care and sometimes even died. So a lot of Americans have a negative view or perspective of the insurance companies. But nobody's ever taken it to the streets, right? So this guy, whether he was in his right mind or not, actually planned this out, knew what he was going to do, and took this fight to the streets. He wasn't even covered by UnitedHealthcare, but UnitedHealthcare is the biggest healthcare insurer in America outside of the government. And so that was his intended target. Like I said, in this day and age, or like we just went through this election, right? Mm-hmm. And people were saying, if I don't get my way, if this candidate doesn't get elected, then all hell's going to break loose. So we kind of have that environment right now in America, but to see somebody act on it the way that he did was a bit alarming. But I can understand why the emotions run each way. If you're somebody who's had somebody die because of the lack of care and the insurance company's denial, or been injured or had a bad outcome because of it, then you're on the side of like, hey, man, maybe this guy did the right thing, right? Not that murder's the right thing ever, but you can understand people's emotions. And then there's people in the other camp who are like, this is terrible for his family, which it is. But more than likely, there are people who haven't been harmed by the insurance company at this point.
I am glad to hear your response in that regard. This morning on my KPFT 90.1 FM program at Pacifica Network, we were talking about that. And, it's a responsibility when one is speaking to a large audience to be careful with the wordiology. Mm-hmm. And I try my best to do that. But also, I'm glad the measured response that you gave, because a caller called in, and because I made a statement similar to yours, he said, by the way, Egberto, suppose after listening to your call talking about CEOs that causes the dying, the deaths of many of their citizens, suppose somebody listening to you say, yes, I need to do something about that, and they go and execute. Should we blame you? Should we then say you caused the murder of somebody? And I explained the differences in what I do and what the insurance company executives do. And also that, no, we are not asking anybody to go out there and take the matters into their own hands. But I want to ask the question. I brought that up as a precept to ask this question. If you listen to the DA yesterday of New York, the DA of New York, and all the people in the legal community that charged Mr. Luigi Mangione, they were really adamant that this guy did the wrong thing. He took the law into his hands and he's an evil person. Don't you think that it is high time that the media look at the health insurance industry as a villain that kills and talk to them just the way they talk about Mangione, who killed that person, who took a life, and the insurance companies that take hundreds of thousands of lives.
Yes, they kill people legally, right?
Right.
Right. So healthcare in and of itself is very personal to the person receiving the care. But the business entities that grow up around that, the pharmaceutical companies, the insurance companies, the pharmacy benefit managers are there to make a profit off your money. So, healthcare is set up. The insurance companies are hoping you'll pay your premiums, you'll live a good life without any major disruptions health-wise in your life, and you'll die fast. And if you do that, you're fine. If you don't do that and you get a nasty cancer and you want to go to MD Anderson, well, all of a sudden it's out of network, right? Now you got to pay out of your pocket. Or if your doctor wants to prescribe a chemo drug for you that he knows is going to work, they say, no, you got to go back and use this lesser price chemo drug. They have no medical expertise. All they're trying to do is look after their shareholders' profits. But you hit the nail on the head. They legally kill people all the time. Legally, people have negative outcomes and live in bad conditions because the insurance company makes a decision. They control the amount of money that goes out. So much to your point, yes, I do think the media should start to look at them as a business entity who is only trying to make profit and doesn't really care about the patient themselves. I mean, we've seen artificial intelligence used by UnitedHealthcare to deny claims. It's a fast, efficient model. You don't have to pay a doctor. You don't have to pay a nurse to look that claim over. You just use the AI and deny. And what they do is they hope when they deny those claims that you'll go away. But 90% of the people who actually go after those claims, they actually win them. So not a lot of Americans know that they can, go after the claim and take it up to state attorney general and say, I need some help with this. And 90% of the time they win. So these insurance companies know what they're doing. I mean, this isn't, it's not an accident. They're just trying to make as much money as they can. And they're making huge profits at the expense of Americans every day.
And it's amazing that you said they know what they're doing. They know that eventually they'll likely lose the case. But two things happen when they eventually lose the case. The patient, if they were ill enough, could die, at which case nothing is paid anyway. Or as they wait, they're building up time, and they know most people won't go through the trouble, like you said, of doing that. What is really concerning to me as well is that, again, at any given time, I don't know what the percentage is, but let's say at any given time, 2 or 3% of the people are sick in this country. I think that is one of the problems why people don't really see the urgency of the problem. Enough people at one time don't see the urgency of the problem, because if only 2 or 3% of us are really sick that have to interact with the insurance companies at any given time, we have a tendency in our society to be very forgetful of the past once things are over. It's like January 6th happened and everything is okay now. Nobody understands how dire a situation that is. And item after item, issue after issue, it seems like we are, and I don't know if we're designed that way or if the way our society works in America makes us that way. What's your thoughts on that?
Yeah, so I think this guy who committed the murder set off.
Yeah, Mangione.
Yeah, right. He set off reaction. So as I'm studying this in the American people, I mean, there were people that were elated that he did this, right? I mean, yes. How many times do you see that? People who think he's a hero. So in your January 6th comparison, that happened. There was a lot of bickering back and forth about what really occurred or what the truth was. In this situation, this guy is rewarded for his behavior by some people who say, you know what, they got my aunt, they got my mother, there's insurance companies, about time we got one of them. Right or wrong, that's the way that they feel. But if you look back to things like Columbine, nobody was shooting schools until that occurred, right? And then all you got these copycat killers running around shooting schools, going in and harming children. And what I'm afraid of is that we're going to see a little bit more of this before it's over. That there's going to be people who think, you know what, I'm going to do what that guy did because my mother died of a nasty cancer and was denied care. So you've seen the insurance companies' reaction to this. They've taken down the bios. Aetna's taken down their bios. Major insurance companies are starting to beef up security for their executives. But why aren't they looking at their model and seeing what caused this? Why America's perception of them is so negative? Why don't they look at their business model? I mean, good God, they're making profit hand over fist. You don't need to make that much profit. You could give back to people who are really sick. It's just an insane model. And it's insane that we as Americans continue to allow it to happen, right? Because our country has some of the worst healthcare ever. And I don't mean that by doctors and nurses. What I mean is the system itself. So, we're 17th in quality outcomes in industrialized countries. Right. Yeah. And people are always like, I want to have choice. They don't see what's really going on because they haven't been exposed to different models. It's just crazy. But, when you start to fire up the American public about something like this, you got to watch out because, like I said, if people are calling him a hero, there's going to be other people who are probably thinking right now what they can do to impact the healthcare insurance companies.
It is amazing that you use the example of what I guess the insurance companies have learned a lot from the gun industry. Instead of tackle the problem, double down and prevent it from. I mean, it's like what's the problem to guns? More guns. What's the problem to the insurance? Surround yourself by gun. I mean, it is just amazing how these people think. I read you now. There's another issue that I want to point out to our listeners. To show the evil within, and somebody told me evil is kind of mystic. Maybe it just is the bad within. But you remember the times when Medicare came out. The reasons for Medicare was because insurance companies couldn't figure out a way to make a profit on older Americans. So therefore, they were either insuring them at a very high rate or not insuring them at all. Here comes Medicare. Medicare goes ahead and handles insurance for them, and they give now that they have a backstop, insurance companies say, okay, the government is taking care of Medicare. How can we get our foot in there? Hey, government, for what you're paying in Medicare, give us a fixed cost and we'll take care of it for you now. Suddenly, they can afford to do Medicare. I wonder what's the cost of that. Explain the ills of Medicare Advantage versus Medicare.
Sure. So let's just break it down into something that's really basic, a business principle. If you have a CEO that's making $10 or $15 million and is managing your care at an insurance company, why would you continue when you're going into your golden years to pay them to manage your care? Because Medicare Advantage has been shown to deny claims that traditional Medicare would pay. And not only that, Medicare Advantage programs and different hospitals are saying, they deny it so much, we just don't want to work with them. So now, if you're an older American and your community hospital says they're not going to take your Medicare Advantage plan anymore, you have to drive 2 or 3 hours to go to another hospital that will take it. It's a scam. Medicare Advantage is a scam. Anytime you can remove the insurance companies from your health care, and you have the opportunity to do that when you turn 65, you should go straight to Medicare. The problem with that is it's very confusing. Like, most Americans don't know what to do. So then we have the Medicare Advantage people bring in these independent counselors, right, that steer you towards a plan with them. Oh, we'll give you a little dental. We'll give you some vision, all that kind of stuff. They're there to make a profit. They're not giving you anything for free. They're there to make a profit. If you go to straight Medicare, then you never, ever have anybody interfere with your doctor and your care. You can go get care anywhere. Medicare pays 80%. You get the gap insurance that goes with it, which is actually an insurance company, but there's different rules at that point. They can't deny care. They just have to pay the 20%. So it's interesting that we have a model that works well for older Americans and that these insurance companies want to get their foot in the door and continue to make a profit after you turn 65. Steer clear of Medicare Advantage, people.
It is amazing because they didn't want to do it until they had the government to back them up. These are the people that don't want government. Interestingly, even if we take a look at the NHS, the National Health Service in Great Britain, now that they're bringing the private sector more and more into their system is getting worse and worse. It was a system that was, again, yes, you wait longer for a hip replacement. That's not an emergency, but it's a system that worked, a system that you never went bankrupt, etc. Now, some of them are attempting to follow some of the U.S. model, a failed model. Now, you wrote a book. And we spoke about this before. And what I want to do here is because I think if we get people more educated on our healthcare system from people who've been there, who understand it, I think it's essential that we inform folks about it. So anybody who's written a book about what's going on that is a fair and honest book, I want to make sure they have a chance to talk about a little bit about their healthcare within the context of their book. So please go ahead and talk to me a little bit about how to avoid being a victim of the American healthcare system, a patient's handbook for survival, a book written by you, Dr. David Wilcox.
Yeah. So, interestingly enough, when I finished my doctorate, I thought I have so much knowledge of the healthcare system. I've been in and out of it. I know exactly what to do when an insurance company denies my claim. I know exactly what to do. And not a lot of Americans know that. And so I sat down to write this book because I wanted to give them a handbook. Like some people tell me, oh, I read the entire thing. It's great knowledge. And some people will say, I bought it and then I had a problem with my insurance company denying me a claim. So I went to the insurance chapter and I read what you had written and I used some of the loopholes that you suggested and they actually paid my claim. So I just wanted Americans to be informed. Now, if you go into the American healthcare system and you have no knowledge of it, that's a very dangerous position to be in because medical errors are still the third leading cause of death. So think about that for a second. And it's not like people want to error, but there's doctors and nurses who are pushed by these insurance companies to see certain amounts of patients. And sometimes they make mistakes. It happens. You just don't want to be on the other end of it. So this book is geared to make you knowledgeable about the American healthcare system. So when you walk in, let's say you're going for an elective surgery and you bag up your own medications because you read the chapter about going for surgery in the book. And so you bag up your own medications and you tell them, while I'm here in the hospital, I want you to give me my own medications. Boom. You're not getting the $50 Tylenol, right? And the upcharge for that. Or if you're going to get surgery, you want to be the first case of the day because that's when your surgeon is the sharpest, right? So, and plus you're not going to be able to eat or drink anything. So wait till 4:00 in the afternoon is miserable. But statistics show that first cases of the day do better than last cases of the day. So, all these kind of things that I picked up on my healthcare journey while I was in the business and still am, I just put it on paper because I want to help people. I've heard from a lot of people who said it was life-changing. They knew what to do. One guy told me when he had started asking the surgeon all those questions, are you on call the night before? I want to be in first case of the day. And that surgeon was just like, are you a doctor? And he's like, no, but I'm educated. Uh-huh. So, that book, How to Avoid Being a Victim of the American Healthcare System, you can find it on Amazon. You can also find me if you need a more personal approach at drdavidhelps.com, drdavidhelps.com. I'm out there. I'm here for you. I want to make sure that everybody's educated. And, healthcare is very personal. And so when we have business entities that don't treat it that way, we as Americans need to hold them accountable.
I will have all of that information in the links because more now than ever, we need a lot of what the knowledge that you've put out there. By the way, I don't remember. Is there a chapter on Medicare Advantage in there at all?
No, there isn't. And that's the one thing I've been toying with writing a book about Medicare in general and Medicare Advantage, and because I get so many questions about it. That's like probably the number one question I get all the time. How do I
have a suggestion for you, Dr. Wilcox? A real good suggestion, and that is your book is already on Amazon. Your book is already in ebook form.
Yep.
You don't have to you just add another chapter, an appendix to that book that you already have written, and just add it in. It's kind of dynamic these times with the way you can do books, because I think that is important. And then re-release the book, because more than ever, we need a lot of what you speak about, my brother.
Yes, I agree with you 100%, especially as people are aging and they don't. I mean, Medicare doesn't make it easy to sign up. Let's figure you got to have Part A, B, D if you're using prescriptions, and then you got to get gap insurance. Whereas the Medicare Advantage, the one thing that they do have and they market very well is, hey, no problem, man, I'll take care of you. It's going to cost you a lot less money. Come on over here. You know what I mean?
Mm-hmm.
But in the end, they are an insurance company. They're there to make a profit, and if you get really sick, you're going to have problems.
Well, Dr. Wilcox, you've spoken to me before. What should I have asked? What should we have talked about that we didn't?
I think we pretty much covered it. I'm hoping that my Columbine theory is wrong, but I just, that the reaction from Americans on both sides of this issue is definitely speaks volumes to me about, I don't think this is going to be a one and done incident.
Well, it's interesting because a plurality of younger folks, and it's amazing that I find it to be that of younger folks. A plurality of them actually are on the side or said that he did. They're lifting him up as a hero for finally giving the system. Our system needs a lot of work, and we're going to have to find a way to do it, and we're going to have to find a way to do it peacefully.
Yes, we are. Definitely agree with you. And also, one thing we probably should discuss is under the new administration that's coming in, Dr. Oz is a big believer in Medicare Advantage. He holds over $500,000 worth of stock in UnitedHealthcare, at least in 2022, when he had to reveal all that to run for office. So he's going to be pushing to privatize Medicare. So when we start to see that, we need to fight back, because that is the wrong move. That's not a move for Americans. That's a move for profit, to put money in people's pockets and privatize Medicare using Medicare Advantage. So stay alert and stay focused on that issue.
Well, you will be back on again, Dr. Wilcox, because we have to make sure and keep folks informed. We know the mainstream media, who gets a whole lot of money from all these different insurance companies, they will not spend the necessary amount of time. They will mention it, but they won't spend the necessary amount of time on it where people are actually hearing the message. Dr. Wilcox, thank you so kindly. Author of How to Avoid Being a Victim of the American Healthcare System, a Patient Handbooks for Survival, that you can find at Amazon and in the links in the accompanying blog. Thank you so kindly for having been on Politics Done Right.
Thank you. It's always a pleasure to see your smiling face, my friend.
Thank you, my brother.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.